Good morning, guys. My name's Matthew Pollock from Healthy Body Solutions, and today I'm going to talk about the prison diet. There really is a good reason for talking about the prison diet. I do a lot of work with patients, from young children with learning and behavioural difficulties through to older patients dealing with anxiety, depression, and a lot of mental illness. And it's very, very underestimated just how much changing a diet around can be when it comes to the impact on mental health. The prison diet is a perfect example of this. There were a number of experiments performed in the United States on prison populations where they changed their diet around. If we're looking at a prison diet, it's generally a pretty poor diet full of high fructose corn syrup, sugary diet, cordials, white bread, pastas, grains, and these really don't have substantial nutritional value for the people that are eating those diets. It's fed in prison because nobody really wants to spend money on a prison population, but I'll give you a couple of good reasons why we should consider changing that around. Number one is it does alter mental health and it does alter the state of the patient, and these prison experiments were a great example of that. They got rid of a lot of those standard American diet high sugar products in these prison populations, and they did experiments where they brought in top quality chefs and real good quality food, and they cooked for 6 to 8 weeks for these prisoners, and they gave them good quality food, fruits, vegetables, meats, chicken, fish, and took away all of the sugary products, gave them water and things like that. And what they actually noticed was, over the period of the next couple of months, in certain prisons that did this, they'd also had a dramatic reduction in violent outbursts and violent interactions between prisoner to prisoner and prisoner to prison guard. And they found that when they measured this, they actually got reductions of about 70%, which is incredible. So you think about how much that's changing a prison population, which is just incredible. The important thing for us is these prisoners need to come out and be rehabilitated back into society again. So we really should be thinking about what we can do to make that transition better, and how can we bring out a better member of society that's going to contribute and not harm the rest of us when they've done their time. The second example of this experiment was a company took over a prison in the United States and converted their diet over, and this was a vegan diet. Now, I'm not necessarily advocating a vegan diet. It's generally a tool to get a job done. However, what we notice is the proportion of rich, dense nutrients in that diet was substantially better than what they were currently being fed. This diet really, what they were focusing on were outcome measurements of recidivism, and what we were looking at there is basically repeat offenders in the prison. And before this group took over, the level of recidivism in this prison population was about 95%. So basically, there's a 95% chance that once a person leaves prison, they're going to be returning back to jail again. That's not a very good outcome. Over the 7 years that this group managed that prison facility and the diet was changed to a vegan diet, that figure dropped to less than 2%. So think about that. They're changing the mental state of those prisoners to a point where they're not coming back to prison anymore. Now, I don't know about you guys, but that seems to be a much better outcome, and I'd like to have that person brought back into society rather than the person who's continuing to act violent and continuing to have disagreements within the prison population and against staff members too. This is really important for me because I see it every day in practice. When you do this with patients, they change substantially as well. But let's extrapolate this even to the government and to healthcare. Imagine how much chronic disease and illness we're going to change by doing that. Imagine how much mental illness we're going to change doing that. Imagine how much Medicare bill is going to change if we feed people right. So I'd like to make a call out to the government to consider that they need to be very serious when regulating health and heightening the importance of being aware of what's a good diet and what's a bad diet. And we really need to think about this for our future. It's so clear-cut in how much of a difference it can make for people's health. So we need to do it within our own homes. We need to do it within our own society. We need to do it possibly within prisons and things like that, looking ahead. And it really does make a big difference. All right, something for you guys to think about. Thanks very much for taking the time to listen, and I'll talk to you soon. Bye-bye.